So what is life like for people at the epicenter of the coronavirus outbreak? Well, take a look at this video. It tells in part the story. Images of a highway in Wuhan before the outbreak. And this is what it looks like now. Well, CNN's David Culver has more on what is happening in Wuhan and elsewhere in China.
A normally traffic-jammed highway in the city of Wuhan, China, near empty, only a few passing vehicles. Public transportation shut down. City buses sit untouched. Only a few residents spotted outside. Eerie for a city 11 million people call home. Major food chains closing to customers, from Starbucks to KFC to McDonald's. Lights off inside. This Walmart open and crowded. Shoppers wearing face masks inside and quickly buying up what's left, leaving bare produce stands behind. Outside the lockdown zone, similar scenes across mainland China.
There's 24 million people in Shanghai, and I'm walking in the middle of the street.
American college student Jenna Davidson arrived in Shanghai a few weeks ago for the spring semester.
You know, we got here before the outbreak, and it went south really quick.
She says finding food in the massive city has gotten increasingly difficult.
They shut down our campus. We almost felt as though they didn't realize that we were still living on it because we didn't even have like hot water for a few days, and the cafeterias on campus are closed. So we started realizing, well, we need food, and most stores within walking distance have been shut down, or it's like zombie land in there. Everyone's fighting for what's left on the shelves.
Jenna initially tried to keep positive.
This is the guy who takes my temperature 9 times a day.
She even sent this photo to her dad, trying to reassure him.
For a while, I wasn't telling my dad everything, but he was finding out on the news just how bad it was. So it's been hard on him.
She and her fellow classmates now booked on flights to get out. Destination, anywhere but here.
Where are you going?
Africa.
Who do you know in Africa?
I don't know anyone in Africa. And what's most stressful is, even though we're leaving, I still don't feel like we're in the clear yet, because what if we catch it in the taxi or at the airport, on the way home, on the plane? We still need to be very careful. It's not over yet.
Back in Wuhan, social media shows how some residents keep moving inside their own homes, finding normalcy within the lockdown. But a look outside, and you're reminded life here is anything but normal. David Culver, CNN, Beijing.
Now, a short time ago, the World Health Organization declared the outbreak an international public health emergency. The organization's Director General explains why they've taken this step.
The main reason for this declaration is not because of what is happening in China, but because of what is happening in other countries. Our greatest concern is the potential for the virus to spread to countries with weaker health systems and which are ill prepared to deal with it.
Well, the virus is now spread mainly in China, with more than 8,000 confirmed infections there, at least 170 deaths. But it has touched many other parts of the world. And the number of coronavirus infections has just surpassed the number of infections in the SARS epidemic, which hit in the early 2000s. In mainland China alone, the coronavirus cases have outpaced SARS' global total, although right now the death rate is much lower. Let's take a look at how quickly the virus has spread. Just last Friday, there were only 941 global cases confirmed. Now, less than a week later, that's jumped nearly 9 times higher. And the numbers are still rising. Well, meanwhile, the Centers for Disease Control and Prevention have just confirmed the first case of human-to-human transmission here in the United States. Well, I want to take a closer look at this right now with our chief medical correspondent, Dr. Sanjay Gupta. Good to have you here with us to break this all down. So the World Health Organization says it's making this declaration not because of China, but because of other countries affected by this. Just practically, what does this declaration mean?
Well, and the other countries that are affected by this, there are many of them, but in at least 5 other countries besides China, you're now seeing human-to-human transmission. Last time the World Health Organization met, they said, yeah, we acknowledge this is an emergency in China. Let's wait and see what happens in the rest of the world. And now we see it. And so there's evidence of spread, and there's evidence that that spread will grow. What this is not, this public health emergency, is not more funding, really. You know, it's not more financial resources necessarily, although it may be a redistribution of resources, especially to countries that need it. You know, developing countries where they may have a harder time taking care of an emerging outbreak like this. It also, I think, sends a signal how important this is to the world, and may impact trade, may impact travel in terms of what these countries are going to do to try and mitigate the outbreak. We're seeing some of that already, obviously.
Exactly,
the biggest quarantine in history right now taking place in China. There's been these travel restrictions out of China. So you're seeing some of that. I think you're going to see that more amplified now as a result of this declaration.
Yeah, exactly. 60 million people in China already facing travel restrictions,
which
is significant. And the WHO initially were reluctant to declare this a public health emergency because they were worried about the economic implications. They were worried people would cancel their business trips and their holidays. But clearly they now must think that the benefit of doing this outweighs that risk.
That's exactly right. I mean, I think that was the reason they were hesitant to do this before. It's a big deal. And by the way, these declarations, they didn't exist before SARS. SARS sort of made the World Health Organization realize they needed some sort of body and some sort of declaration like this to be able to handle it. So you've had, you know, H1N1, Ebola, Zika, things like that. So this is another public health emergency. And I think that the idea that you're going to be able to signal to these countries what is appropriate in terms of travel and trade is very much part of this. It's going to have an impact. It's going to have an impact on these economies for sure.
There's no doubt about it, and it already no doubt is in China.
Right.
But in terms of how this virus compares to other respiratory illnesses, it seems right now, at least from the figures we're getting in, and we might not be getting the full picture, but from the figures we've got, it seems like the death rate is much lower than a lot of other respiratory illnesses.
Absolutely, and this is sort of one of those things where in public health, I think there's always this belief, or this concern rather, that could this be something that spirals into a large lethal pandemic, like what happened in 1919, what happened in 1969. There's not evidence of that right now. In fact, the death rate, as you mentioned, is lower than we saw with SARS. There's probably lots of people, I think, Linda, even within China, maybe other parts of the world, that may be carrying this virus now and have no idea because they either have no or minimal symptoms. So as that number of infected grows, without the number of deaths growing correspondingly, the fatality rate comes down even further. So it's bad news in that it's spreading, but good news in the sense that it may not be as serious an illness in the vast majority of people. That's something that we'd want to see.
Yeah, exactly, and let's hope for that. Dr. Sanjay Gupta, as always, thank you for joining us.
I'll be
Appreciate
back.
it.